Thank you so much for inviting me to share my journey with you today. I really appreciate it. I guess I'll start with telling you, how did I end up getting involved and finding out about overseas surgery? I kind of guess in my 20s and into my 30s, my lymphedema slowly kind of progressed from stage 2 to stage 3, and just kept getting more and more severe infections, despite, wearing compression 24/7, swimming, going for MLD on a regular basis, watching what I ate, things like that. And for me, the infections were just getting more and more severe every time I got one. So it was getting scary for me. And I just thought there must be something else I can do. Like I've tried everything. There must be something. And I stumbled across a patient forum on Facebook where they were talking about lymphatic surgeries. And coming from the background of being a health librarian, I was really intrigued by that and thought, I've never heard of that. Like, I've never heard of the possibility of surgery. We're not even supposed to get a cut or an insect bite. Like, how can we possibly cut open our limb? Like, that just seems like a bad idea. And but I was curious. And so I thought, well, I'll just see what I can find in the published literature. And when I started looking, I couldn't believe what I could find. There was just so many studies that there are surgeons out there that have been doing this for 30 plus years in Europe. And I just thought, okay, like, this is a treatment plan that I don't know anything about. I got to talk to my healthcare team here and see what they think. And so that's just where I started with it. And I ended up deciding on pursuing it through I couldn't find anybody here in Canada at the time to do the surgery for primary lymphedema in my legs. So I ended up finding Dr. Becker, Dr. Becker. She's from Paris, France. And she specializes in surgeries, especially for primary lymphedema. So I was really interested in seeing her. So I went through the process of the it's called out of country. I'm going to get it wrong now. It's like out of country health services committee. You have to apply to them for any surgeries that are outside of Canada. And so we had to kind of go through the hoops and prove everything. My application ended up getting rejected because the surgery was considered too experimental, even though it's been around for a while. And 3 years later, I was able to have surgery in Canada. So I think it was on their radar. They just, maybe the right people didn't know about it. But anyways, it was the experience of having this surgery was very beneficial. I haven't had any more infections in my left leg since I've had the surgery 3 years ago. It improved my mobility. My quality of life is much better. Like, I can bend my leg in new ways. It's not as heavy physically and doesn't feel as heavy. The skin tissue is a lot better. One of the biggest benefits, I think, is just the quality of life. You really get your life back, which is really wonderful. You can fit into normal clothing, normal shoes. You can do normal activities. You're not always planning around your condition, which is a great benefit and something we don't always talk about. Kind of almost like a spooning effect, where, when you've got more severe lymphedema, you might plan out sort of what you think you can accomplish in a day and then take stuff off because it's going to make your lymphedema worse. Or things like that. Or if you plan around it, saying, well, if I'm going to be standing or doing this today, I'm going to need extra compression before and after, kind of thing. And I've found greater ease since the surgery, and able to just not be so stressed about that, because my leg feels so much stronger and healthier. It's more responsive to therapy. So when I go for physio, or I do yoga, or I go swimming, or I have lymph drainage, the tissue just responds better to, and compression, all that as well is really great. I've had a huge benefit from it. So about 3 years recovery from the first surgery. Dr. Becker did like a SAPL surgery, which is the suction assisted protein lumpectomy on my left leg, and that had that had the most severe infections and had lymphedema the longest since age 5 in that leg. So they felt it was pretty fibrotic and could definitely benefit from that. They piggybacked it with a VLNT at the same time. So they inserted that into my groin. So I got the 2 surgeries done at once, which was nice because I was overseas. I only stayed a week, or I think 10 days after the surgery. And then I was cleared to fly home after that. It was a painful ride home because you're bandaged and bruised. And then, 3 years later, I was able to have surgery again here in Canada with Dr. Kennedy in Calgary, who's trained in the different microsurgeries. And he's been wonderful to work with. He's very knowledgeable. He's very kind. So he worked on my right leg. And that surgery was very helpful. In both cases, they didn't take out a lot. Like some surgeons will take out a lot, like as we saw in the surgery presentations today, like 4 liters or more. For me, I had 2.5 liters taken out in my left and just a little over 1 liter in my right. But I still benefited greatly from it. I was worried it was too little to make a difference, but it really did help. My tissue responded and did really well. I think in terms of things to know going through the surgery is just to build yourself a plan. Like a pre and post-op protocol could be really helpful for patients in Canada, and guidelines for physicians and stuff, because in both cases, like when I went overseas, nobody here knew about this surgery. So I had to kind of build my own plan as to what should I do before surgery and what should I do after surgery to assist with my recovery. And Dr. Becker and I worked on that together and followed what she recommended. But when I came back here, like my healthcare team, I just kind of had to tell them what I wanted to do and hope that they were okay with it, because there just wasn't guidelines and stuff. And so we monitored it and we measured myself before and after, and that was really nice. So we were able to collect some data from it. And that was great. The recovery is hard. You really want to give yourself some space and time and family support and things like that, because your leg will be very sore, or arm, depending where you have it. But for me, my leg was very sore and very bruised in both cases after. You can definitely get some post-op swelling. So they really like to wrap you right after the surgery, and you kind of have to stay wrapped for about like 4 weeks, at least to, with changes in there, like not leave them on for 4 weeks, but about that time before you're really ready to get into compression garments, because your size is fluctuating so much in that time span that if you get measured too early, then by the time the garments come, they might be too big. So I found wrapping to be the best way to do it. The second time around was helpful in that I kind of knew what to expect. I knew what to expect in terms of how I was going to feel afterwards. Like I found after the first one, I was really exhausted. So my body just wanted to sleep like about 16 hours a day. And I think just to help with that recovery of tissue and stuff, which I wasn't expecting. I don't normally sleep that many hours in a day, that's for sure. More around like 8 hours. So just knowing that that was going to happen was helpful. Knowing that I had neuropathy from the SAPL procedure in both times, where just sections of my leg really felt numb for quite a while after the surgery. And then the space where it was numb just kind of eventually got smaller and smaller and smaller. And it just more sensation came back with it, and just doing different treatments and things for myself. There's a lot of self-maintenance, I'd say, involved in our care, whether you have surgery or not. So knowing sort of what to expect as you go through the surgery can be really helpful before and after. And I think building yourself a team and letting those people know that you're having surgery is really, really helpful. I was really glad to have that support of having like a lymphedema clinic where I could go for massage. And like Dr. Becker told me to go like 4 times a week for like the first 2 weeks after surgery, and then kind of weaned myself down to like 2 times a week by a month. And then as soon as all my incisions healed, to get in the water, because she felt the deep water would be the most benefit, because it could provide that compression while I'm still getting exercise. So I did that as much as I could, which is great. I definitely went like a few times a week, and it made a big difference for me. Yeah, so I'd be happy to answer any questions. If anybody has anything they want to ask. I hope that was helpful.
Hi, Amy, it's Diane.
Hi.
Very helpful again. And if anyone wants to ask a question, put it in the chat, or just unmute yourself and ask the question. Oh, here, I'll ask you the question that's in there right now.
Yeah.
It says, how much was the SAPL, I don't know how you pronounce that correctly.
Yeah, SAPL. How much was it? That's a great question. It ended up being like 22,000 Canadian, about that. And then I had travel expenses to get there and back and stay in Europe. So it came close to 30,000 by the time I paid for myself and another person to come with me, to make sure I had a caregiver, just to get me out of the hospital, because I didn't know how groggy I'd be or what the procedures were like. I didn't know how many days I'd be staying there. I ended up going to Rome, actually, even though she's from France, because one of the interesting things in Europe is they do a lot of cross-country collaboration. And so she was in Rome to teach some other plastic surgeons about her techniques for lymphatic surgery. So she said, why don't you come meet me in Rome, and I can operate on you there, and then it's cheaper than if I do it in Paris. So that was a nice benefit for us. And thankfully, the second surgery that I had here with Dr. Kennedy, Calgary, was covered by Alberta Health Services, so I didn't pay anything out of pocket.
Oh.
Yeah, I get to know my shoulder. Wants to join
in. Janice says thanks. And Deborah has stated thank you for to our amazing thriver, Amy.
Yeah, they have a great little online program where they promote different lymphedema thrivers. They call it Thursday Thriver, and they do little posts about different lymphedema thrivers and how they kind of get through their day, and how they've learned to live well with lymphedema. And I love seeing the thrivers that they put up there. I got to be one once, so that was fun.
Oh, that's great. Okay. And Deborah also says, thanks for sharing your experience. Always have your own plan.
Yeah, because what worked for me may not be, and how I had the surgeries done may not be what's recommended for you. And it's just kind of up to you to figure it out with your surgeon, what type of procedure and whether you're a good candidate. Like, I didn't know if I'd be a good candidate with Dr. Becker. I sent her photos, and we kind of had chats over the computer, and then I had to go there and meet her. So I went the year before I had the surgery with her. I went there and met her and had an MRI, and we had a chat, and because they wanted to see whether I was a good fit or not. And the MRI was actually super helpful, and it's so neat to see they're doing some Margie presented. They were doing some MRIs in Alberta now for kind of learning about the lymphatics, and it was like so neat to see that happening.
Good.
I didn't go back to see. I see a question about, did I have follow-up with Dr. Becker? I just had phone call follow-up with her, and I sent her pictures of my progress and measurements and stuff like that. But I didn't go back to see her. So I haven't seen her in 3 years.
What could Dr. Kennedy not help you
Oh yeah, for sure. Just the question was wondering if I had follow-up with Dr. Becker, like after I had the surgery with her the first time. And it was just kind of a virtual follow-up with her. Yeah, but Dr. Kennedy was able to, I shared kind of pictures before and after, and just kind of shared information as, what my leg felt like before and after. One interesting thing was I had a lot of, and I'm sure not the only lymphy, but I had a lot of swelling around my knee joint, and which causes a lot of pinching and pain and things like that. And they were able to, after the surgery, they said, we took a lot out around your knee. So it's probably going to feel really different when you move and when you walk. And I felt in some ways that I had to kind of relearn how to move my leg again, because I could bend it in totally different ways than I could before. And I had some popping and some crackling at first. And but yeah, it was great. And when you can move your joints more, like we all know, you can stretch and compress those muscles more, which is going to pump more lymph. So I think getting out of the joints was really key. Definitely made me feel better. Yeah, Deborah commented that they have Dr. Sibba Hackle is at the Toronto General, which is great. I think she spoke at the last Canadian Lymphedema conference, and she is trained in the different, I believe in the 3 different surgery techniques, which is great. I don't know which one she can perform. I remember she was mentioning that she couldn't perform some of them because OHIP doesn't cover it. I don't know if that's changed. There's also Dr. Constantine at the Humber River Hospital. There's a doctor in Vancouver that I've heard about as well. And then there's the group in Montreal that we've kind of seen at the conference here, which is really great. So yeah, it's definitely growing in interest, which is neat. I've definitely seen a decrease in cellulitis, and that was a big interest in my part because I was having such strong infections that since surgery, I haven't had any in my left leg, and I've had 2 minor ones in my right leg, which has been really great. So, but the research that kind of got me interested in pursuing it was finding some research articles that were saying it could reduce your risk of cellulitis infection by up to 70%. And I thought, well, sure, sign me up. That sounds great. Cellulitis is awful to deal with because it just progresses our condition and it's very deflating, right? You get it and poof, your leg's big again. And you may have gained so much that year and then you lose that gain pretty quickly. And I found I couldn't get my leg down as quickly or as easily after cellulitis. For me, it was, it would turn fibrotic a little bit more. And it wasn't just me saying that, but the therapist would notice that too, like your tissues changed since your infection. And so compression, all the tools that you use just don't seem as effective once you've got the fibrotic component in there. Yeah. And since surgery, because my tissue is so much softer and squishier now, that I do find that response from massage and compression and stuff just really nice. So that's motivating because you do all the same things you were doing before surgery and now you're seeing greater benefit, and it just really pushes you to keep going forward.
That's great.
I wondered if I could ask just a question a little bit more from the standpoint of your recovery. Kind of what the progression was from, obviously you had the 10 days post-op, you flew back, but after that, how you kind of moved gradually back into function, your exercise regime and all those different things, what that looked like for you.
Sure. I'd say like for the first 2 weeks, just like the first day after the surgery, like when I got out and I had to get up to go to the washroom, like that was tricky, just like to be able to walk to the washroom. Then the next day I was like, okay, I can walk around my room and around my bed a couple times. And then by like a week out, when they sent me back to, because I think I stayed there for about 4 days in the hospital. And then I stayed a week at like an Airbnb with a friend. And by I think like 7 days post-surgery, I could walk like 1 block around. And by then I was just like sore and exhausted. Just lots of bruising, lots of tenderness. And you don't have a lot of feeling in your leg, at least for myself. I had some nerve challenges there. So I wasn't feeling that steady on my feet. So definitely did lots of like deep breathing and lymph drainage, self massage, things like that, just to kind of help keep things moving, even though I was laying down a lot. Yeah. And then I'd say I was able to progress to going back to like a normal routine, like going swimming, yoga, things like that, probably by 3 months. And not a lot of tenderness or bruising or anything by that. After the first one, my little ones were so little, they were sad they couldn't sit on my knee because it hurt too much. Just the pressure of just even a little one who was like 20 pounds on my leg. I was like, no. So I had to convince them to sit. I was like, you can sit on the other leg. I can't have you on both. And they adapted quickly, but by, I'd say like 3 months, they could sit. And things like that. So, and then it just keeps getting better. Like I'd say I peaked in terms of like feeling the best by like 9 months or more out. So you got to kind of like build that time into your head that it's, not a snap, you're better kind of compression or kind of treatment.
For sure. Thanks so much.
You're welcome.
Does anyone else have a question at all? Okay. We do have this recorded, so we'll put it up on our website so people can see it and learn from it, because I think they will. I think for someone that's contemplating having surgery, it would be good to be able to talk to you. So, and
yeah, absolutely.
You would
I'm working, I've been working closely with Dr. Kennedy, trying to see if we can put together some information for patients for like pre and post-op, to sort of what to expect and how to get the most out of it. Like, for example, like what some Dr. Borson and the others were talking about is trying to get as much of the lymph out of the way that you can through conservative treatment is going to make the surgery more successful. And I've found that as well. And both the surgeons that I worked with said that too, just because they want to be able to get to the fat and the fibrotic parts that have built up over time. And so if you can get the lymph down a bit, then that gives them more space to work with. They can get more out that should come out, I guess. And it gets you into that therapy treatment mindset, because you need to be content with self-care and really working on your leg or your arm, wherever you're going to have your surgery, and know that like as soon as you're done your surgery, it's going to be painful, but you're going to have to do those treatments afterwards. And the nice part is you see the results. And so that does keep you motivated to keep doing that therapy and the compression. I know some surgeons in the States, they want you to put on compression garments right away. And with all that bruising and tenderness, I can't imagine having to pull on like a tight flat knit class 3 garment over top. It'd be painful, but I can see why they do it, because it takes a lot less time. So you might have higher compliance than, say, asking a patient to bandage for 4 weeks, which when Dr. Becker asked me, I was like, oh my God, that's a lot. But like 24/7, I couldn't put anything else on. Just like, nope, just bandages. It's too tender. You won't want anything else on it. Anyway, trust me. I was like, oh, okay. But it did help. And I can see her point. By the time like I got to those 4 weeks, my leg was a totally different size than if I got measured for compression as soon as I came home or something. So it was worth waiting and kind of fluctuating, but maybe that would be a good place for like wraps, like those Velcro wraps instead would be a really good place for that, instead of short stretch bandages or something like that. could be an interesting modality to try out.
That's for sure.
Mm-hmm.
Okay, so thank you for the people that have joined us today to listen.
Yeah, thank you, everyone.
And we will put it up on our website. We'll have to edit a bit, and not your part. At the beginning trying to figure out what I'm doing, but yeah. But thanks so much, Amy. On
You're welcome.
Ella. Thank you.
Yeah, and just wanted to mention, if you think of any questions afterwards, feel free to send me an email, or you can find me on Instagram. I'm just at lymph.well. And I use that as my platform to sort of share my surgery journey too. So you can always kind of scroll through there and see. I posted pictures kind of after surgery to show what my legs look like during the process, and just to mentally track it for myself of just like, oh yeah, this is what it looked like 2 weeks after, and this is what it looked like, a year afterwards and stuff like that. So yeah.
Great. Okay. Thanks so much.
You're welcome.
Thanks
Bye.
so much, Amy. Take care. We'll talk to you soon.
Thank you.
Bye.
Bye.